What if I told you that the position you sleep in every night is slowly suffocating your lungs, trapping mucus, narrowing airways, and causing the morning breathlessness you've accepted as normal, and that simply changing your sleeping position could transform your breathing within a single night? Right now, millions of seniors are sleeping in positions that actively damage their respiratory function for 8 hours every night, waking up gasping, congested, and exhausted, never realizing that their sleeping position is the primary culprit. Meanwhile, those who discovered the optimal sleeping positions for lung health are waking up breathing clearly, with open airways and comfortable breathing, simply because they changed how they position their body during sleep. This isn't about minor improvements or marginal benefits. This is about the difference between waking up suffocating versus waking up breathing easily. Your sleeping position determines whether gravity helps or hinders mucus drainage, whether your airways stay open or collapse, whether inflammation increases or decreases overnight, and whether you wake up refreshed or exhausted. For common sleeping positions are destroying your breath right now, and one optimal position can restore the breathing comfort you thought was lost forever. In the next few minutes, I'm going to reveal the 4 sleeping positions that are destroying your breath and exactly why each one is so damaging. Then I'll teach you the optimal sleeping positions that promote easy breathing, complete with specific techniques for positioning your body correctly. I'll explain the science showing why position matters so profoundly for overnight respiratory function. And I'll share stories of people whose chronic morning breathlessness disappeared within days simply by changing their sleeping position. Your breathing could transform starting tonight if you know how to position your body for optimal lung function during those critical 8 hours of sleep. If you wake up every morning feeling like you can't breathe, with your chest tight, your airways clogged with mucus, and your lungs struggling to expand, you know how much this affects your entire day. Maybe you wake up multiple times during the night gasping for air. Perhaps you dread mornings because you know the first hour will be spent coughing violently trying to clear your lungs. You might wake up exhausted despite sleeping 8 hours because your breathing was so poor all night that you never achieved deep, restorative sleep. These morning respiratory symptoms are so common in seniors that most people accept them as inevitable, but they're not. In many cases, they're the direct result of sleeping in positions that sabotage respiratory function. Here's what most people don't understand about sleeping position and breathing. During the 8 hours you're sleeping, gravity is constantly affecting how fluids and mucus move in your body. Your airways can collapse or stay open depending on your position. Inflammation can worsen or improve based on how your tissues are compressed. Your diaphragm can move freely or be restricted by your body position. All of these factors determine whether you wake up breathing easily or struggling, yet almost nobody considers sleeping position when addressing breathing problems. After 60, sleeping position becomes even more critical because age-related changes make you more vulnerable to position-related breathing problems. Mucus production often increases while clearance mechanisms slow down, meaning mucus accumulates more readily. Airways become more prone to collapse. Tissues are more susceptible to compression and inflammation. The diaphragm may be weaker and more easily compromised by poor positioning. All of this means that sleeping positions that might have been tolerable when younger become actively harmful after 60. The 4 positions I'm about to reveal are extremely common. Millions of seniors sleep in these positions every night, unknowingly sabotaging their breathing for hours on end. When I tell you what they are, you'll probably recognize that you sleep in one or more of them. The good news is that changing position is completely free, requires no equipment or medications, and produces results immediately, often the very first night you make the change. Thousands of seniors who learned about optimal sleeping positions and made the change describe waking up breathing clearly for the first time in years. Morning congestion that had plagued them for decades disappeared. Nighttime awakenings to gasp for air stopped. Energy improved because sleep quality improved when breathing was no longer compromised all night. The transformation was so dramatic and immediate that they couldn't believe something so simple had been the solution all along. Let me reveal the 4 sleeping positions that are destroying your breath and explain exactly why each one is so damaging to respiratory function during sleep. Destructive position number 1 is sleeping flat on your back with no elevation. This is one of the most common sleeping positions and one of the worst for breathing, especially after 60. When you lie completely flat on your back, several harmful things happen to your respiratory system. First, gravity pulls mucus from your upper airways down into your lower lungs where it pools and accumulates. You have no effective way to clear this mucus while sleeping flat, so it sits there for hours, creating obstruction and breeding ground for bacteria. Second, lying flat allows your tongue and soft tissues to fall backward, potentially narrowing or blocking your upper airway. This is why snoring and sleep apnea are much worse when people sleep on their backs. The airway obstruction reduces oxygen levels throughout the night, causing you to wake up exhausted and breathless. Third, lying completely flat can allow stomach acid to flow backward into your esophagus and even reach your airways, causing inflammation and irritation that worsens breathing. Fourth, the flat position provides no assistance from gravity for lung expansion or drainage, meaning your respiratory system works harder with less efficiency all night. The consequences are waking up with thick mucus that's extremely difficult to clear, feeling like your lungs are full of cement, experiencing chest tightness and breathlessness, having a sore or irritated throat, and feeling exhausted despite sleeping for adequate hours. If you wake up this way regularly and sleep flat on your back, position is almost certainly a major contributing factor. Destructive position number 2 is sleeping curled up in a tight fetal position. Many seniors gravitate toward this position because it feels comforting and secure, but it's terrible for breathing. When you're tightly curled with your knees pulled up to your chest, your diaphragm is compressed and cannot move freely. Remember, your diaphragm is the primary breathing muscle, and it needs to flatten downward to draw air into your lungs. When you're curled up, your thighs pressing against your abdomen prevent this diaphragm movement, severely restricting how deeply you can breathe. Additionally, the curled position compresses your chest cavity, limiting how much your ribcage can expand. Your lungs physically cannot fill to their normal capacity because your body position is squashing your chest. You end up taking shallow, inefficient breaths all night, which means poor oxygenation, frequent awakenings, and waking up feeling like you never got enough air. The restricted breathing also means carbon dioxide builds up because you're not ventilating your lungs adequately. This further contributes to poor sleep quality and morning breathlessness. The consequences of sleeping curled up are waking up feeling suffocated, having difficulty taking deep breaths in the morning, experiencing muscle tension from maintaining the curled position all night, and feeling anxious or panicky upon waking because your body has been oxygen deprived. Many people wake up from this position feeling like they need to immediately sit up and take huge gulping breaths to compensate for the shallow breathing they did all night. Destructive position number 3 is sleeping on your stomach. Some people sleep this way thinking it helps breathing, but it actually causes multiple problems. When you sleep face down, your neck must be turned to one side to allow breathing. This twisted neck position compresses one side of your airway while stretching the other, creating mechanical strain and reducing airflow. You cannot maintain optimal airway alignment when your head is turned sharply to the side for hours. Additionally, the weight of your body pressing down on your chest and abdomen restricts both lung expansion and diaphragm movement. You're literally squashing your breathing apparatus between your body weight and the mattress. This severely limits breathing capacity and efficiency. The position also puts significant strain on your spine and can cause morning pain that makes breathing even more uncomfortable. The consequences are waking with neck pain and stiffness, feeling like you can't take a full breath, having compressed airways that take time to open back up after you change position, and experiencing spinal discomfort that makes breathing movements painful. If you wake up needing to stretch and move around before you can breathe comfortably, stomach sleeping is likely contributing. Destructive position number 4 is sleeping propped up but in a slouched or jackknifed position. Some people try to elevate their upper body for breathing by propping up on pillows, which is the right idea, but they do it incorrectly by simply putting pillows under their head and upper back. This creates a jackknifed position where their body bends sharply at the waist. While the head is elevated, the bend at the waist compresses the abdomen and restricts diaphragm movement just like the fetal position does. Additionally, This slouched position can compress airways in the neck and restrict ribcage expansion. You end up with some of the benefits of elevation negated by the compression at the bend point. It's an inefficient compromise that doesn't provide optimal breathing support. Now let me reveal the optimal sleeping positions that promote easy breathing and how to achieve them correctly. Optimal sleeping position number 1 is the elevated side lying position, specifically lying on your left side with your upper body elevated at a slight angle. This is the single best position for overnight breathing for multiple reasons. First, lying on your left side allows optimal drainage of mucus from your right lung, which is larger and produces more mucus. Gravity helps move mucus toward your larger airways where it can be cleared. Second, the left side position keeps your heart position optimal for circulation without putting pressure on major blood vessels. Third, elevation of your upper body prevents acid reflux and uses gravity to help keep airways clear. Fourth, the side position keeps your tongue and soft tissues from falling backward and blocking your airway. Here's how to achieve this position correctly. Place a wedge pillow or elevate the head of your bed so your upper body is raised about 30 to 45 degrees. This isn't a sharp angle, just a gentle incline. Lie on your left side on this incline. Place a pillow between your knees to maintain spinal alignment and prevent your upper leg from pulling your body forward. Use a supportive pillow under your head that keeps your neck in neutral alignment, not bent up or down. You might place a small pillow or rolled towel under your waist for additional support. This position allows your diaphragm full range of motion, keeps airways open and aligned, uses gravity to prevent mucus pooling and acid reflux, promotes drainage from your lungs, and maintains comfortable spinal alignment. Many people report breathing more easily within the very first night of sleeping in this position. Optimal position number 2 is the reclined position with proper support, useful for people who cannot comfortably sleep on their side. Elevate your upper body significantly, at least 45 degrees, using a wedge pillow or adjustable bed. This is more upright than most people naturally sleep but provides excellent breathing support. Place a small pillow under your knees to prevent sliding down and to support your lower back. Use a neck pillow that supports your head without forcing your chin down toward your chest, which would compress your airway. This semi-upright position prevents mucus pooling, keeps airways maximally open, prevents acid reflux, allows easier diaphragm movement than lying flat, and can significantly reduce snoring and sleep apnea. Some people find they breathe so much better in this position that they prefer it despite needing time to adjust to sleeping more upright. Optimal position number 3 for people who must sleep on their back is the elevated back position with strategic support. Elevate your upper body at least 30 degrees. Place a pillow under your knees to maintain slight bend, which takes pressure off your lower back and helps prevent sliding down. Use a cervical pillow that supports your neck properly while keeping your airway open. Some people benefit from a chin strap that gently prevents mouth breathing and keeps the jaw in position that supports airway patency. The key with any optimal position is adequate elevation. Flat is your enemy when it comes to breathing during sleep. Elevation of at least 30 degrees, preferably 45, makes an enormous difference. You can achieve this with wedge pillows designed for this purpose, with multiple regular pillows arranged carefully, or ideally with an adjustable bed that maintains consistent angle all night. Let me tell you about Dorothy, a 71-year-old woman who had been waking up gasping for air every morning for 5 years. She would spend the first hour of every day coughing violently, bringing up thick mucus, feeling like she was suffocating. Her nights were terrible because she would wake up multiple times unable to breathe comfortably. She was exhausted constantly because she never got restorative sleep. Her doctors prescribed inhalers and other medications, but nothing helped her morning symptoms. Then Dorothy attended a sleep study where the technician observed that she slept flat on her back all night, and when she did move, she curled into a tight fetal position. The sleep specialist explained that both positions were sabotaging her breathing for hours every night, causing mucus to pool, airways to collapse, and breathing to be severely restricted. Dorothy had never considered that sleeping position could be causing such severe problems. The specialist taught Dorothy about the elevated left side position and helped her obtain a wedge pillow. That very first night, Dorothy slept on her left side on the elevated wedge. She woke up the next morning shocked because she could breathe. The usual violent coughing fit didn't happen. Her chest didn't feel tight and restricted. She had some mucus to clear, but it came up easily instead of requiring an hour of struggle. After 1 week of sleeping in the optimal position every night, Dorothy's morning symptoms had improved by about 70%. After 1 month, she was waking up breathing comfortably for the first time in 5 years. Her sleep quality improved dramatically because she wasn't waking up gasping for air anymore. Her energy increased because she was finally getting restorative sleep with adequate oxygenation. Dorothy says changing her sleeping position transformed her life more than any medication ever did. The key to success with optimal sleeping positions is making them habitual, which can take some adjustment if you've slept differently for decades. Use positional aids like body pillows or rolled towels to help maintain desired position. If you tend to roll onto your back during the night, try placing a tennis ball in a sock pinned to the back of your sleep shirt to make back sleeping uncomfortable and encourage side sleeping. Give yourself at least 1 week to adjust to a new position before deciding it doesn't work. The breathing benefits are worth the initial adjustment period. Sleep medicine specialists and pulmonologists who understand overnight respiratory dynamics consistently recommend elevated side sleeping for people with breathing problems. Research on sleeping position and respiratory function shows clear benefits of elevation and side lying compared to flat and supine positions. Studies document improved oxygen levels, reduced apnea events, better mucus clearance, and reduced morning respiratory symptoms when people sleep in optimal positions. The insider knowledge that specialists share is that sleeping position is one of the most powerful interventions for overnight breathing and morning symptoms, yet it's rarely addressed in routine medical care. Doctors prescribe medications without discussing position. Sleep studies focus on diagnosing apnea without teaching optimal positioning. Many breathing problems could be dramatically improved with position changes alone. Here's something shocking. Research comparing overnight oxygen levels in people sleeping in different positions found that some seniors desaturate, meaning their oxygen levels drop dangerously low, dozens of times per night when sleeping flat on their backs but maintain normal oxygen when sleeping elevated on their side. Same person, same night, dramatic difference based solely on position. The revelation is that your morning breathlessness might not require more medications. It might just require sleeping in a position that supports rather than sabotages respiratory function. When you change to optimal sleeping position and wake up breathing easily instead of gasping, the psychological transformation is profound. Mornings become pleasant instead of dreaded. Sleep quality improves, bringing better mood and energy. Confidence increases because you found something that works. Quality of life transforms when breathing stops being a constant morning struggle. We've covered the 4 positions destroying your breath. Flat on your back allowing mucus pooling and airway collapse. Tight fetal position restricting diaphragm and chest expansion. Stomach sleeping compressing airways and breathing apparatus. Slouched propped position creating harmful bend at waist. We've revealed optimal positions. Elevated left side lying with proper support. Reclined position at 45 degrees. Elevated back position with strategic pillowing. The question is whether you're going to change your sleeping position tonight or continue waking up gasping. Get a wedge pillow or elevate your bed. Position yourself on your left side tonight. Notice tomorrow morning how different you feel. Your breathing transformation could begin with tonight's sleep. Change your position now. Your lungs are waiting for 8 hours of proper support instead of sabotage.